Yeah. Hi, everyone. Welcome to our Social Innovation Summer Training Workshop 2023. I think now Joe should be on his way to Singapore to attend APACC conference. So he has told me to convey his regrets for not being able to attending our session. Yeah, anyway, I feel really delighted to be with you today. And today we will have a talk by Hannah, Jorab, and Jason from the Hi Philippines Hub, and Wenjie is from Hi China Research Hub. And today they are going to give you an overview of social innovation and its components and the characteristics. And the title of their talk is Social Innovation in Health, the definition and frameworks. And so without further ado, I will turn things over to you. The first group, Hannah, Jason, Jorab, and Wenjie.
Thank you so much, Yusha. Muhammad is also part of our group. So there are five of us who are the co-facilitators of this session. Um, can you just confirm that you're seeing my screen and that you can see the whole of it?
Yes.
Anyone? All right. So thank you very much again for that introduction, Yusha. And I really hope that all of us are excited, not just for this session, but for the rest of the workshop series. So let's kick off with this one, the definitions and frameworks of social innovation in health. And for this session, our objectives are these that at the end of it, all of us will be able to describe social innovation in health more in depth and in our own words, and then to be able to discuss the components and the process of social innovation, and then given cases or examples to be able to identify and discuss the characteristics and the outcomes of social innovation in health. And another sub-objective actually of this is for all of us to also have some ideas of how to run a similar workshop or session if you want to do a similar one, introducing social innovation in health to maybe our colleagues or students. And as with the other workshops that will follow, this will be more interactive compared to the series that we did last year. So I really hope also that you were able to take a look or to watch the presentation last year, because we won't be going over those concepts again. But this session is really meant for all of us to be able to share our ideas and to really learn from each other. So what we're going to do is we will have a short icebreaker and introductory activity. And this will be followed by just a brief presentation of a framework that outlines the components and the process of social innovation. And then we will spend bulk of the time in breakout groups. So that's where we will view a video or of a case of social innovation in health. And then we will be discussing it amongst our group mates. And then finally, we'll just go back to the plenary for a short synthesis. So let's jump right in. So to start, this is what we're going to do. We will all draw our own social innovation in health concept web. So I hope that everyone has actually an access to a piece of paper and a pen or a marker. And in that piece of paper, draw a concept web that's similar to the one on the slide, this photo. Put social innovation at the center, and then just fill the web with words, ideas, concepts, phrases that come to mind when you think about social innovation. So of course, there are no wrong answers here. Just feel free to write whatever that comes to your mind. And we will be giving you 3 minutes for this activity. So let's all start now. I'll be timing it, or Jory, please help me time also. 3 minutes. We have 30 seconds left for the activity. All right, so the 3 minutes are up, and we really wanted to start with this activity because we know that all of us already have an idea of what social innovation in health is, and we wanted to call those out first. And at this point, we'd like to invite everyone for a group photo of us holding up our concept webs. So if you're able to turn on your cameras, your videos, please do so. And let's take a photo of us with our concept webs, just for documentation and for fun. Okay, let's wait for a few seconds for everyone. And I'm going to request Jose to help us take the photo, please. But let's wait a few more minutes for everyone to be able to show it. Yeah. Sometimes the lighting is pretty tricky, but I see your wonderful maps there. I see more people turning on their cameras, so maybe a few more seconds. Uh, if no one's going to follow anymore, okay, let's just take this photo. Jareb.
Okay. On three. 1, 2, 3. Smile. Okay. Yeah.
Yeah. Okay. Thank you, everyone. And at this point, also, we'd like to invite you guys to write in the chat those phrases or words that you wrote. If you could please share some of the ideas, some of the words that you put in your concept webs. Charlotte says diverse actors, co-creation, active participation. I think Jared is putting his, I know, just a photo of the group. Social transformation, collaborations, unique solutions for unique problems, community, design thinking, intersectionality, social objectives first, yes, partnership, all aspect engagement, complex problems, participatory, people participation, community-led, ground-up approaches, systems thinking, new or update, group work, yes, implementation science, human-centered. Thank you so much. I'll stop right there because I'm sure, but you can feel free to just put more of your ideas. But let's just move forward also. And again, thank you very much for sharing your ideas. Actually, all of those things that you put there, you will see later on, are reflected in the concepts, in the definitions, and in the frameworks of social innovation. So just to share with the group, in 2017, Edward Shater and Wallace, they did a systematic review. Actually, they looked into 60 years of trying to define social innovation in general, and they were able to identify 252 discrete definitions of social innovations. And I remember a professor of sociology gave us a lecture a few months ago, and she said that it's actually good that there are lots of definitions of social innovation because that breadth of definition innovation. And that is a good thing because it will encourage more people to do that. And in 2021, Dr. Van Niekerk, Dr. Manderson, and Dr. Balabanova, they did a scoping review of the application of social innovation in healthcare. And in the background of that paper, they also tried to categorize the existing definitions, key definitions of social innovation, and to look at the key themes or the characteristic aspects of social innovation that can be found in these key definitions. And these are the four categories of those aspects that they found. So a lot of the definitions define social innovation as something that addresses social needs, new initiatives to improve society, so societal needs, And some of the definitions focus on the process that is participatory, that there are new relationships and practices. Some definitions focus on the agency that happens or that is observed, the empowerment of people for action. And some of the definitions focus on the change that happens at the institutional and systems levels. And again, these themes and categories are reflected in those ideas and words and concepts that you shared in your concept webs. And also these characteristic aspects and themes are also already reflected in our key definitions of social innovation and health. So again, if you were able to view the presentation from last year or to read CHI documents, these are some of our key definitions of social innovation and health. So this is just a review for all of us. When CHI started to identify social innovations in health globally, this was the working definition. So social innovation in health can be defined as a solution, which could be of any form. It could be a process, a practice, a new program, a market mechanism, a finance model, and they are implemented through diverse organizational models developed by a range of actors, usually different actors coming together. It is in response to a health challenge within a specific context. It challenges the status quo, so there is health system transformation potential, and it enables healthcare to be more inclusive, effective, and affordable. And then in a more recent definition, by Dr. Halpaap and other CHI colleagues, and this one focuses more on the process. They define social innovation in health as a community-engaged process that links social change and health improvement, and it draws on the diverse strengths of local individuals and institutions. So you look at the assets first of these individuals and institutions. And the argument is that when you have the end users or the local beneficiaries and community members, when they are the ones who drive the development of a health program, this actually results in more sustainable and accountable services. And then this slide just shows you some of the frameworks, and some of them we presented again in the lecture last year, and we can give you the links or the references to these. But for this session, we're going to focus on this one, which is again from the paper of Van Niekerk and colleagues, the application of social innovation in healthcare. And this actually draws from this co-production framework by Ayob, Teasdale, and Fagan. They just put more elements on it here. So let's just take a moment to dissect this a little bit. The social innovation, here it shows that it starts with the challenge, and this is the stimulus for the innovation. And as you all mentioned earlier, it's experienced based on a specific context with different factors. These challenges that are most effectively solved by social innovation are what we call wicked problems or grand challenges. They are complex and systemic. And then what happens is there is the component of participation. And I think this is really what sets apart social innovation from just purely technological innovation. There are new forms of social relations. This is where you have the different mechanisms of co-production, co-creation, co-design. Someone mentioned earlier, diverse actors from it could be from the government or non-state actors. There could be hybrid organizations as well, such as social enterprises. And usually in the process, there is cross-boundary or cross-sectoral collaborations that are formed. And if you also see here at the rightmost side in the framework, the process usually starts with a lone hero. So sometimes there's one social entrepreneur or one small group or one organization. But as the process goes, more and more actors come in until ultimately it becomes an initiative of a collective group. And then because of the participatory approach, there comes the creative solution or the innovations themselves, which again could be of different forms. And sometimes they are really totally new or novel, but many times, and I think this was also mentioned earlier by someone in the chat, that sometimes they are just combinations or a bricolage of existing products or ideas, or it could be an existing idea that's applied in a new context or adapted to another specific context. And then, because of the process of coming up with the innovation and because of the innovations themselves, there comes empowerment. So the social innovation increases participation levels, it empowers people, people get new social capital or political capital. There's a shift in power dynamics, and it even creates more agency among people. And then ultimately, there's a change at the institutional and systems levels. So there is changes in what they call internal institutions or mindsets, and also external ones, what we see the structures and the systems. And of course, there is societal impact. And here at the bottom, they just provide in the paper. So again, we really recommend that you read this paper. They provide here some paradigms and theories which we can use to explain or help us understand better the process of social innovation. And for example, if you're focusing on the creative solution itself, then you're looking at it with an instrumental or technocratic paradigm. And you can look at theories from policy studies and organizational and management studies. And then if you're looking at more at the empowerment process that happens, so you're looking at it with a democratic paradigm, and you can use some theories from the integrated development framework or capability approach. And then if you are more interested at looking at the changes at the institutional and systems levels, you're using an institutional or structural paradigm, and you can look at theories from structuration theory and resilience theory. So if you have time and you're interested, you can look more closely on those frameworks and theories that help us understand the process of social innovation. But at this point, how else or what better way for us to understand further the social innovation process than by looking at examples? So this is now our time to go to breakout groups. And in our breakout groups, I think we will just divide the whole group into two. What do you think, guys? And then we'll be assigned one case for each group. And then what will happen is we will watch a video, and then we will be discussing amongst ourselves the case based on the framework that was presented earlier. So we can talk about the challenge. What was the health challenge? Let's describe it within the specific context and the experience of the people. And then we can also delve deeper into the participatory process. Who are the actors involved? How were actors included or added? How were they encouraged to participate? What were the new social relations? And then we can also talk about specifically the creative solution. How is the innovation actually novel and tailor fit for its context? We can also talk about the empowerment that happened. How was that demonstrated? What were the new capabilities, collective capabilities that were granted the participants? And then what are the institutional or systems changes? And how did it contribute and demonstrate societal impact? So I hope we're all excited to go into the groups. Yusha and or Joreb, do we have the groupings ready? Or
Yes,
Yeah.
we now have two separate rooms, and the first
Mhm.
room will be Wenjie and I think Wenjie and Jeraba, and the second room will be
yeah,
you,
okay.
Mohammed, and Jason, I think,
Jason.
and yeah, and now I open all the rooms.
Thank you. And then after 30 minutes, automatically we will be going back to the plenary. Thank you, guys. See you in the breakout.
Uh, I don't think the participants have been assigned to the rooms yet.
Uh,
Uh,
yeah,
yeah,
I think
I'll just do it.
can
Yeah.
we, let me see. Oh yeah, maybe we can.
Oh,
Hi, Melida. Winner, can you join the record? Oh, hi, Mohammed. Do you want to? Can you be able to join the breakout room, room 1 or room 2?
Yes, I'm here. Where am I?
I think you should. I think we have invited you to join the room 2, and you should just there should be
Yes.
a button for you to move to the separate room 2. Can you see it?
Oh,
Mm-hmm.
no, I've not seen yet.
Uh,
Where to press? Where to press?
let me try again. Can can you see?
Okay. Yeah. To
Okay.
join room 1.
Okay.
Okay. Yeah.
Okay. Okay.
Joreb, I think you can synthesize. Close.
Hello. Yeah. Wait. So we're not. So are we still going to have the groups explain their or okay. Okay, I think we're out of time. Also, for this session, we've explored various definitions and frameworks of social innovations in health. We've also looked at each group, breakout group, looked into a specific case of social innovation in health. So one group examined the Inter-Island Health Service Boat project from the Philippines, while the other uh, uh, looked into the Kaundu community-based health insurance in Malawi. So maybe we can, for the members of the other group, you can just look at the recording. Hopefully, it will be available so that you can get another example. So how we looked into these social innovations, we looked to their components. So what is the health challenges that they tried to address? Who were the actors or who participated, from the health workers to the beneficiaries themselves to governments and other partners. And also we looked into what made their um, solutions innovative or creative, how it was specific answer for their specific context, uh, and then how it empowered to this specific committee and beyond. So thank you for attending this session. Hopefully you learned something or it enriched your knowledge regarding social innovation in health. Anna or Isha?
Yeah, I think
Okay.
you should, because I'm conscious of the time. Yeah, we're supposed to share what the discussions was, but I don't know if people can stay for a few more minutes. What do you think? Just one person from each group anyway to share what were the main insights. Is that okay, Yusha? Can we still have like 5 minutes?
Yes, sure. No problem.
If not, we can. I think the recording will be available.
I don't think we
Yeah.
recorded our breakout.
Okay. Yeah, someone recorded
Sorry.
for our group.
Yeah.
Yeah.
Yeah, so maybe just
Yeah,
briefly,
maybe.
yeah, Jason will share for our group regarding the Kaundu, yeah, um, community-based health insurance. So the main insights from the discussion. And then from your group, Joreb, who would do that?
Maji, would you be okay, or I can also do it?
Okay. Yeah, let's hear from Jason first. Thank you.
Okay, so for the Kaundu community-based health insurance scheme, the challenge was a little background on the challenge was that free healthcare services provided by the government are not readily accessible to the committee members. So communities in hard to reach areas are forced. However, 50% of the Malawians are living below the $1.25 per day poverty line. So they were not able to afford these healthcare services. So the creative solution was to create a community-based health insurance, since the national government could not provide health insurance. And because each individual household in the villages could not afford to pay large amounts for health services, small amounts were collected from each member household to lessen the burden on the entire community. By doing so, the villagers pay less when they were actually in need of these healthcare services. So the insights from the group were one, you can accomplish things, you can accomplish innovations without the need for a big infrastructure. And community participation and community engagement makes it sustainable because you're involving, particularly for this project, they were involving the village chiefs. So yeah, and one other insight also was that the program prioritized children and pregnant women because they're the highest risk for healthcare um, issues, and it adds to the effectiveness of the project. And another thing was that they educated the members on the concept and importance of health insurance, of social uh, nakalimutan ko was the term, sorry. Any social
Solidarity, was that
there we
the
go,
term?
yes, thank you.
Yeah.
Social solidarity. So uh so it was also noted that because of this program, there was an increase in health utilization and increase in health seeking behavior, because now they could afford services that they could not afford before. And the challenge, and it was noted that the challenge within the context is what creates the innovation, because of this particular innovation, communities learned how to handle money and even used some of it to improve their agriculture, becoming one of the impacts of this program that was outside of its intended purpose. So, yeah.
Thank you, Jason, for that good summary for discussions. The other group, please.
Yeah, I'll give the summary. So for the 5 questions, so the first is the challenge. So our case is the inter island health service boat project. So a challenge for this community was that access to health services, particularly for pregnant women. Uh, yeah, there's problem with the access because it's island community on several islands, so it's difficult to transport people to from their homes um, to the health centers, or yeah. And so the solution, of course, it would answer the problem of access by getting boats that are specifically um, used for these health services. Um, so that's what our participants identified. But also additionally, they also identified that part of the creative solution was to create a way to sustain the innovation. So funding scheme that would compensate the resources used and the people, of course, to give them uh, earnings or wages. So participation, the actors involved, of course, the health workers and the beneficiaries themselves, but also other partners such as government or private sector who who donated boats. So the changes that occurred were that there was better access to health services, particularly for pregnant women. It it decreased home based delivery, increased utility of the services for pregnant women, and so it empowered the beneficiaries and also the healthcare workers. So, yeah. If I forgot anything, Isha? No, Benji. Sorry. Did I forget anything, Benji?
No. I think you have.
Okay, yeah.
Well, yeah.
Okay, then I think we're okay. Hannah, Yusha.
Thank you everyone for participating. And I know the time is short, but hopefully in the next workshops, we'll have more time to discuss other innovations and other aspects of how to look at social innovations in health. So again, thank you very much for participating and for the fruitful discussions. Yusha, any more announcements?
Oh, yes, I just want to say thank you very much for Hannah, Jorab, and Jason, Mohammed, and Wenjie for doing such a fabulous job. And I think the content was really rich and interesting. And yeah, and here I have attached the link to our website, and you can see the archived videos and related materials of our previous sessions. And I will also upload the video of our today's session to our website for your review. And so as for our next speakers on June 13th, we will have Emmanuel, Ellen, and Catherine, and Eunice to talking to us about crowdsourcing for social innovation in health and health research. And I think which will help you to understand how crowdsourcing open course could be conducted and its pros and cons. And yes, and tomorrow I will send you the pre-reading materials of our second session. And thanks Emmanuel and the second group to send me the pre-reading materials. Yeah, and then I would like to say thanks again to everyone to join us, and see you next week, and bye. Have a good day.
Thank you.
Thank
See you
you.
again next week.
Everyone. See you again.
Thank you. Bye.
Bye.